How many times have you heard from a friend, a family member, a loved one, the quote, "But I don't believe in chiropractic"? That's something I've heard for over the last 15 plus years, and I wanted to address that in this video so that if you're watching this and you're someone who doesn't believe in chiropractic, hopefully I can give you some insight. Or if you have a family member, a friend, a coworker, or someone that argues with you or maybe says something that incites some question in your mind, you'll at least have some food for thought. So first off, chiropractic is not a belief system, meaning it's not a religion, it's not something you have to have faith in, it is really just understanding principles of how the body works. Now, up until this point, we talk a lot about the difference between chiropractic principles and philosophy and other types of healthcare, like the allopathic or the whole medical philosophy. We are not anti-medicine at all. You don't have to choose one or the other, but it really just depends on what situation you're in. Meaning, if I was mountain biking and I broke my leg, for example, and my femur was sticking out of my leg, don't take me to a chiropractor. As much as I understand the principles of how the body heals itself, that requires intervention. That means that we have the best technology to save your life in a crisis situation or put you back together again if a bone is sticking out of your leg. That is the allopathic model. It's an outside-in model. It's take something from the outside, fix something that broke down in the inside, and then away you go. But they do that with the faith, for, I guess, lack of a better word, or maybe they do that with the understanding that they know that the bone is going to heal on its own. You're going to line it up, you're going to help, but then it's going to actually heal. There's no healing happening from putting it back into alignment. No surgeon cuts into someone unless they completely understand and accept the fact that that wound that they cut open is going to mend and going to fix. And there's nothing that we do as human beings that causes that to happen. That is an innate, inborn ability for our body to heal itself, thankfully. So as far as back to the whole chiropractic thing of not believing in chiropractic, chiropractic is based on this thing called a subluxation. Subluxation is a very real and measurable thing. You can call it whatever you want, but a bone can misalign in the spine. It can happen from birth. It can happen at a very young age. It can happen in the elderly. But if you haven't been checked for subluxation and you're going through life, you probably have one. It's almost impossible not to have one. And the difference is that you may have not manifested a symptom yet. Remember, most subluxations don't cause any pain at all. So by the time someone has pain, it means the nerve is inflamed, their body's already in a crisis. And the problem is that the organs at the end of those nerves are already being affected, could be breaking down. You may not be symptomatic yet, or you may have some kind of organ symptom that you never thought was neurologically driven or nerve related from something that could have happened from a spine injury or a subluxation. So chiropractic is based on the understanding of this thing called a subluxation. Bone misaligns, and it swells up the disc, it irritates the nerve, and it causes a problem. Fortunately, in the Gonstead system, we have a very methodical approach of tracking down the signs of a subluxation. That subluxation causes swelling on the surface of the skin, changes the temperature on the surface of the skin, usually causes muscles to splint and spasm in very small amounts around that joint, and decreases movement of that segment. Then we can reference back on an x-ray and see mechanically how things are aligned and make the best clinical decision of how to introduce a corrective force or thrust into the body to change the alignment and motion characteristics of that segment to put it in a healthier position to get swelling out of the joint and irritation off of the neurological structures around there. That's it, plain and simple. That is a subluxation, and that is how we find it and how we fix it. It's not a belief system. It is a fact whether you believe in it or not. And I feel sorry for someone who doesn't believe in it because they're missing out on this super vital component that maintains your function and ultimately your health. So I know I'm just explaining this to you, and I don't know if that really helps combat if someone says I don't believe in chiropractic, but really it comes down to it's not really a belief system, and it's taking them through a process of understanding how the body works. That's how I try to communicate it. Someone talks to me, I say, first off, here's how the body works, and I explain that process before I ever get into chiropractic. So I talk about the brain controls everything. It does that by sending energy down through the spinal cord, comes out through the nerves, controls all the organs. True or false? I mean, that is a true statement. So at that point, you're checking in with someone. Okay, good. Does that make sense? And they're nodding. Okay, yeah, that's interesting. Yep, that makes sense. Maybe I haven't heard it said that way before. And side note, every single healthcare practitioner in the world learns that your brain controls your spinal cord, and then your spinal cord branches off into your nerves, controls all your organs, cells, and tissues. That is a physiological fact. That's not something that chiropractors own. That's not something that medical doctors own. That is a human and really multi-species fact, is that our nervous system is the supreme controller and coordinator of everything in our body. So that's the first thing that someone has to accept. Next thing to accept is that with different traumas and stresses in your life, I mean, who hasn't had a trauma or a stress? You have a stress, you sit in an abnormal posture. You're in an abnormal posture for a long time, it puts an abnormal load onto your spine. That can cause something to shift slowly out of alignment over time and deform into a subluxated or misaligned position. Or it can be trauma. It can be blunt force trauma, slip and fall in the ice, car accident, or it can be repetitive stress. Lifting something the same way over and over again. That joint has to move in a somewhat compromised way over and over. Finally, it fails. So with traumas and stresses in your life, the bones in the spine, they shift out of alignment. That's a fact. When that happens, that causes irritation. And that causes irritation to a nerve. When a nerve is irritated, it's a super sensitive structure, so it doesn't work properly. And so the smallest amount of irritation on a nerve can reduce the nerve transmission or its function tremendously. There was a study a long time ago where they took 10 millimeters of mercury, which is the weight of a dime. They put it on a spinal nerve root. This was a test they did in animals. It was a cruel test they did, but they came up with this conclusion of saying that just the weight of a dime, 10 millimeters of mercury, decreased the function of the nerve between 60 and 90%. Just the weight of a dime decreased the function of that nerve that went into a cell, a tissue, an organ. And over time, what do you think happens to that cell, tissue, organ? It breaks down. So over time, it actually weakens and degenerates and creates disease in that organ. Now, the problem is, and the fact about this, is that most subluxations don't cause any pain at all. If you go back to a previous video where we talked about the 7 laws of subluxation, is that less than 10% of the function of the nerve that comes out of the spine has anything to do with sensory, has anything to do with pain. So you can have a subluxation, not even know it, no pain. So these are the step-by-step processes that I take someone through so they can understand this is how it works, problems happen, and then now you're at a fork in the road. What do? Either just say, well, I don't believe in finding that or fixing it, and I'll just let nature take its course and let my body break down, or I'm actually going to go to a specialist who is highly trained in finding these things and fixing them, like a skilled chiropractor. And of course, I'm biased, and I feel like the Gonstead method is the most meticulous, evidence-based system of analysis primarily done by hand and correction done by hand. That's the core foundation of what we do in this practice, even though we've added other components to that to help support what we do in this Gonstead work. So everything I'm talking about right now is the segment. Chiropractic is the segmental approach primarily, but chiropractic really encompasses a philosophy of how we look at health and healthcare. So the chiropractic philosophy is truth. It's a very true philosophy. It's that function dictates health. It's not how you look or how you feel. It's not presence or absence of symptoms. It's how your body's functioning. So logically, you want to nurture the system that controls function of everything, which is your central nervous system. You have different techniques and you have different ways of finding and fixing these problems. That's why there's so much diversity within our chiropractic profession. I think some of them are much better than others. And I feel like how we have come to the place that we're at now is that we are practicing on the highest level, where we do the Gonstead method of chiropractic for finding and fixing a segmental problem. Then we use chiropractic biophysics to then fix postural problems, which now reinforces strength and stability in the spine and helps that segment actually stay there, so it doesn't just keep having this problem going out of place over and over again, so it gives stability. Then we measure movement. We see how does the segment and how does the posture move in now a weight-bearing normal environment. When you do things, when you pick up your kids, when you get groceries, when you play sports, you have to make sure these patterns of movement are functional and healthy, or the segment's going to break down and the posture's going to break down. So ultimately, I know the topic was I don't believe in chiropractic, and I'm trying to give you a lot of facts, but I'm trying to give you some logic, some speaking points of logic. So again, it's how does the body work? Maybe different models in healthcare, like the outside-in approach, which is the allopathic medical model, which is really good for crisis and trauma care, but not good for preventative or ongoing health care. Then you have the chiropractic approach, which is an inside-out approach, which is saying function is really what needs to be nurtured. So look at the system that controls function, which is your central nervous system. So that's going back and explaining how the body works. And then it's talking about where do things go wrong. So stresses and traumas, things can subluxate and misalign. And then it's what is the intervention? So the intervention now logically is something that has withstood the test of time. The Gonstead method is one of the oldest methods in chiropractic. It's been around since 1923 and it works. There's thousands of Gonstead chiropractors that are the elite chiropractors out there. Not to take away from other chiropractors that don't practice the Gonstead method. I mean, if they're doing a specific approach that's methodical, that utilizes an analysis so they know what to work on before they work on it every single visit, and they also look at x-ray and they have other things so that it's not just a one size fits all, everyone gets the same type of treatment. If they have that, then I would say more power to you. But the fact of the matter is if you survey our entire chiropractic profession, you'd find that precision and specificity is a dying art. It's very rare. Most of our patients that come into us have some sort of negative story because they went somewhere where every single patient got the exact same thing done to them, and chiropractic was more of a way to mobilize and just get a bunch of movement in their body, and not really a way to find out where there's a problem and then fix that problem. So I hope that this video helps at least give you some insight and some understanding of how to have a conversation with someone if they say, I don't believe in chiropractic. So it's not an argument, but it's more of just taking them through a thought process. So if you had a bad experience with a certain individual in a profession, you're not necessarily going to curse off the entire profession. I mean, everyone and their uncle has some sort of horror story that someone had a problem with a medical doctor or a medication or a hospital, but we don't say medicine doesn't work and I'm never going to use it. I mean, it has a time and a place, you know, for crisis care and trauma care, it's awesome. But in chiropractic, that happens too many times. Someone says, my uncle's cousin's sister saw a chiropractor one time and they adjusted them and then they had a headache afterwards. Or, you know, my great uncle died from a chiropractor or something. And that's a whole other argument or a whole other discussion. But essentially, chiropractic is extremely safe, extremely effective, and there are differences within chiropractic. For me, I explain to someone when they say, I don't believe in chiropractic, I take them through that whole thought process of logic of talking about, again, you know, how the body works, where things go wrong, and then what do you do from there. Then I go into the Gonstead difference, and I talk about how we as Gonstead chiropractors look at this differently. Then I talk about how even with structural corrective care and functional movement, that, I mean, is the cherry on top as far as there is no comparison. As much as I like to sit here and say all chiropractors are awesome and they all do the same work and go anywhere and you get the same quality of care, it's just not true. It's that some of us practice on a different level. We have invested a lot of time and energy to become proficient in these methods, and we do this simply for results.